Whooping cough cases are on the rise across the country, and that includes right here in Nebraska.
KTV News Watch 7's Eddie Messel has more on the rising numbers and what CHI's chief medical officer says to be on the lookout for.
Across the country, we are seeing a decade high in whooping cough cases. There's currently more than 17,500 reported cases nationwide. Last year, that number was just under 4,000.
One of the telltale signs for whooping cough is that severe cough, the hacking cough that can go on for a long period of time.
According to the CDC, here in Nebraska, there have been 51 confirmed cases. Last year, there were just 11. 30% of them were here in Douglas County, with the health department reporting at least 15 in the Omaha metro area.
One of the reasons might be vaccine rates might be slightly going down. It's really important for kids and adults and pregnant moms to get vaccinated. Another reason is can be during COVID, some of the vaccines, we might not have gotten enough vaccines, or we might not be up to date.
One of the most at-risk groups includes young children and babies.
We recommend pregnant moms get whooping cough vaccines in third trimester of pregnancy, so they have enough antibody to protect the baby. Mom pass on the baby the antibodies up to 6 months of age.
Doctors recommend getting tested as soon as possible if you feel you have whooping cough. As for ways to help prevent contracting or spreading it,
but best way to prevent infections is vaccinations. When you're sick, staying home and getting better and getting medical help. And thirdly, if you're having secretion stuff, not spreading it to others.
It's important to help prevent the spread, with the potential of cases continuing to rise in the fall and winter.
With the cases kind of trending up this year, we might see more cases as the weather gets colder. And I think that's why it's never too late to get vaccinated.
Reporting in Omaha, Eddie Messel, KTV News Watch 7.